basically assists healthcare providers to safely and effectively reposition clients. Its primary purpose is to prevent pressure ulcers and pressure injuries.
The SideLyer allows them to have another position where they can have a table where they have a flat surface and they can look at activity or utilize a piece of equipment and still be able to be positioned out of their wheelchair, and so their skin gets a break.
So high, right? Causing strains, causing pain to get them up into the inclined state. SideLyer's already at a flat state.
The looks that I would get, their jaws would drop and they would go, "Oh my gosh, I've never seen one of these things before." And I would tell them, it's because we made it.
Our reason for being is to be advocates for the individuals we serve. You know, we are their voice because they are the most visible element of our society. They are, and so that's our reason for being.
Hi, my name is Pat Murphy. I'm the CEO at the Ann Stork Center. I have been with the Ann Stork Center for a little bit over 3 years, and was with another organization for 31, and just thought the amazing things that the Ann Stork is doing. I just wanted to be part of it, and I've never looked back. The Ann Stork Center is a special place. It's been in our community for over 70 years. We're helping those birth. We're one of the few birth programs in the county all the way through the end of life. So I think that's the nice thing. We're helping and enhancing the lives of children and adults with developmental disabilities throughout our community. I think the magic of the Ann Stork Center is really that it was started by one person. You know, it tells you the impact that one person can have on the community and the world. Ann Stork Center was a pediatric nurse who wanted to do better in the community. She was a nurse who had a lot of experience in helping individuals, came to South Florida and saw that children and adults were in nursing homes. They were in hospitals. They weren't cared for. And she brought one child into her home, then 2 children into her home. Before she knew it, she had over 20 kids in her home and was like, we need a place for these unique individuals that need our help. So she created the Ann Stork Center, and from 10 to 20, now we serve over 500 people a day and are making an impact in the lives of so many families in our community. I just want to go back to that effect that one person can make a difference. And now we have over 350 employees making a difference in the lives of thousands of individuals with developmental disabilities. You know, we want to create a world where everyone, and this is one of my mottos, where everyone is seen for their abilities, so for the things that they can do. Sometimes in life, people with developmental disabilities are always seen for the things that they can't do. And we think the world would definitely be a unique place if we could all be seen for our unique qualities and all the things that we can do. Yeah, like I mentioned a little bit earlier, Ann Stork started with 1 or 2 people, and it was specific to individuals with developmental disabilities that had medical challenges. And we've crossed the gamut of life now. Like I mentioned, we support 0 through, our oldest resident is 80 years old, and we help people with disabilities through medical challenges, through behavioral challenges. And the component I like now that have been part of but are really evolving to is that we help the family. We give the support not only to the individual with developmental disabilities, but we know it takes a village, and we help all the family, the extended family, to understand that we can have a life without limits. People can learn no matter their ability. Yes, we support adults and children with a variety of developmental disabilities. You know, every person is unique. We take a person-centered approach, meaning you don't come into Ann Stork Center and get plopped into a program. We learn your needs, learn your wants, and develop the program around that. So, person-centered approach, we have early intervention programs all the way up to group homes. We have respite programs where we go into families' homes. We have trainings on campus where parents come into us. So we do a variety. We know caring for a person with a disability isn't a one-stop shop. Families need support. They need physical support. They need emotional support. And we do that, and we lead with love. That's one of our mottos, leading with love. We have, in our ICFs, probably 95%, they're intermediate care facilities. They're more medically involved group homes, and probably 95% of those individuals need support with their mobility. So they're in wheelchairs. So the needs of a person in a wheelchair are varied, from feeding to positioning to getting out in our community with our adapted vans, to the unique adaptive equipment for feeding, for learning, right? For learning, and for, we have eye gaze equipment. There's just some people can move a limb, like their arm or their hand, and other people can move no body parts. So that, along with our behavior focus programming at the Ann Stork Center, we have a variety of people with autism and other disabilities that need behavioral supports, and we provide that as well. That was challenging, actually. Our positioning was basically where the adaptive equipment was. So if the adaptive equipment was on the floor, the person was on the floor, and we're lucky that we position people not that we're lucky, we make sure it happens. We position every person every hour and a half to 2 hours. So we had equipment on the floor, we had equipment on different areas, whether it's in the bed, the floor, and the SideLyer has been amazing. It's been really, I don't know, miracle might be extreme, but close to that, because it allows the freedom of the person to be in different places. So and also the flexibility to adapt the equipment for staff. And that's, can help with workman comp claims. It can help with saving backs. It can really enhance the lives of the people that are supporting our folks, and also, the most important thing, the people that we serve. At the Ann Stork Center, it's so important to have person-centered approaches. And when the SideLyer was included, it gave us the ability to create an environment where people have choices, and that they can, like I mentioned, be on the lower surface area if they want to be, but many people want to be up close to the TV when you're watching it, close to the music when you're watching it, close to an employee when you're interacting and having a conversation, or if someone's communicating with our residents. It's amazing to have the flexibility of the SideLyer to move up and down and be positioned up and down as well. Before the SideLyer, we were using equipment that was stationary. It didn't move. And that has really been a benefit, to have the flexibility and the mobility of that piece of equipment. You can have someone that needs to be moved from a living room area to a bedroom, to a bathroom. And prior to the SideLyer, that was probably 2 positions that we needed to move, which is really stressful for the people that we serve. So the SideLyer really has presented less stress on the people that we support, which is really important for people that are medically fragile. Well, it's interesting with the SideLyer, we didn't know what to expect at the beginning, so we were somewhat skeptical about the SideLyer. We saw the benefits of it, but we didn't know how practically they would be implemented. And I'm happy to say we're ecstatic. We're so excited to incorporate that option into our current positioning at the Ann Stork Center. Yeah, I mean, the confidence, I think we built the confidence. We saw the potential of the SideLyer. We didn't know exactly, the details of it, but once we started learning about the SideLyer and learning about the benefits that would be, to the Ann Stork Center, to our families, to our staff, and really it's about quality of life. It's nice for staff to have convenience, but it's more than that. It's about quality of life. and the SideLyer has provided an enhanced quality of life for the people that we support. Yeah, I think we were excited to have the SideLyer here and didn't know how the training and how that would work, but your team, the SideLyer, the team came, quite a few people from the team, and really made our staff feel comfortable on the usage of it, the technical part of it as far as the physicalness of the equipment, and also how to use it and how to adapt it and how the benefits of it. So having that training and that confidence early on helped us to build, one, the confidence, and also to learn how impactful it could be. I think it became impactful very quickly because of the training that we had from the get-go. I think staff initially are skeptical, but when it's all about the people that we support, and when they saw the enhancements and how that enhanced the quality of their life, the training was minimal. We use SideLyers, so the training was minimal, but this was just the primo of SideLyers. So the training was good. It's important to have good training, but it was easy. It was an easy transition. I think we thought about the benefits, but once we implemented the SideLyer, they were even more, because again, it's about the quality of the resident. When they need to be moved less, their lives are better. When you are maybe on the lower level, closer to the floor, but you need to come up, we would have to physically get a Hoyer lift, move the resident, put them back up in a higher position now. Or if we needed to move them into their bedroom, you had to get them out, get the Hoyer, lift it. Now the SideLyer ambulates, so we can move them up, because you don't want to be moving on the floor. We can elevate them to a higher level and move them wherever they need to go. We even had a situation where we needed to move the person from the group home into a vehicle. So we moved the SideLyer right out to the vehicle instead of moving them into their wheelchair, then wheeling the wheelchair out, then taking them out of their wheelchair, then putting them in their van. So she's probably much better of an answer because I don't know any metrics. I know what I perceive as quality of life, and the agony of repositioning people. No one wants to be repositioned in life, so I don't have the data, but I'm sure she did. What did she say?
She said she measures it in the number of smiles.
Oh my gosh. Absolutely. I was thinking therapy, and I was thinking numbers, but yeah. Yeah, I think it's the less you have to be moved and positioned by someone else, the better your quality of life is. And the SideLyer allows us to minimize the positioning, and not necessarily the positioning, but the movement from position to position. And that means our residents are happy, and if our residents are happy, then we're doing our job and we're happy. I don't know the exact answer to that. I don't want to make something up in that regard, but the folks in our the managers can certainly help with that question, but I'm sure they are involved. I'm sure the parents are thrilled because they want quality of life for their people, the people that are their family, and there's no doubt that the SideLyer has improved their lives. So I'm sure they're ecstatic, and who knows, it could be an option in their home as well. I think it's just about bringing joy. I mean, the staff are amazing to begin with, but when you can make their jobs easier, their life easier, and they can see the joy on the people we support, the joy in the smiles of the people we support, that's what it's all about. And if the SideLyer does that, the SideLyer does do that. So to me, that's what it's all about. It's enhancing the lives of those we support, bringing joy, bringing less complexity to their lives, and the SideLyer does that, brings less complexity to the people we support. I definitely think the SideLyer's definitely enhanced and improved, and I don't know if enhanced and improved is the right word, but the SideLyer has made the need for physical care less. And if you're physically doing less, if you're physically not having to lift people, then that is going to affect the bottom line of workman's comp. We have many workman comp issues regarding lifting, and the SideLyer is helping us lift less and therefore it will, down the road, reduce the amount of workman's comp. We are always looking for opportunities to enhance the lives of those we support, from physical treatment to medical to behavioral. So seeing this opportunity with SideLyer was a no-brainer to try it, and help the people that we support be better and be happier. Absolutely. I mean, I wanted to say it's a risk worth taking, but it's really not a risk. It's an opportunity to enhance the life of someone you care about. It's an opportunity to help the quality of life, and I think we all want to do that for the people we support. When you think about it, there's really no risk. Why wouldn't you try? We're already using SideLyers, but this is just an advanced way of positioning people in a way that gives flexibility, it gives enhancement, it gives quality, and that's what we're looking for. There is no comparison to what we were using before. We are light years ahead of what we were using before. We had no flexibility with the SideLyer at all. It had no way to reposition, and that's the game changer. The flexibility of it, the dynamics of it, being able to meet the different needs of the people we support.
For decades, individuals with profound disabilities have faced challenges that extend beyond their medical conditions. Mobility, social interaction, and quality of life often take a back seat to the struggles of daily care. Caregivers struggled with a critical issue. Clients who couldn't reposition themselves were left in static positions, sometimes for hours or even days. The result? Painful, life-threatening pressure ulcers. For over 60 years, Quest has dedicated itself to providing care and support for individuals with developmental disabilities. And because of that, their clients haven't struggled with pressure ulcers in their facilities because of a consistent repositioning schedule. That routine, paired with their patented SideLyer device, has kept clients' skin integrity remarkably intact.
Quest is a 60-plus-year-old organization, and we're located in Central Florida. We operate in Orange, Seminole, Osceola County, and Hillsborough County. So Tampa and Orlando is where we operate. And we provide a range of services. We like to say all ages, all stages. Our youngest client is a year and a half old, and our oldest is about 80 years old, 85, and has lived with us for 30-plus years. And we work with individuals with developmental disabilities. We're working to help them experience a full life. And so we have residential opportunities for individuals, independent living up to full care. We have a school, Quest Kids Academy. We have therapy centers for kids, day programs for adults. We help people live in the community, and we help people work in the community.
And what are some of the, key pain points or maybe some challenges that your residents who live in these facilities, what do they face on a daily basis?
Sure. So we try to help them experience a full life, whatever that looks like for them, be it more community integration, be it employment, be it education, whatever aspect of their life that they determine is full for them is what we help facilitate. And we meet them where they are, and we try to help facilitate that life.
How does that impact your residents when they are confined to their beds or maybe their rooms all day?
Sure. So prolonged isolation isn't good for anyone, right? And typically individuals are not. We try to integrate as much as possible with their peer group or other social engagements. But if for one reason or another, be it medical or repositioning needs, that someone needs to typically reposition in their bed, then they become isolated, right? And that, of course, has a negative effect on everyone. No one wants prolonged isolation. A little bit of me time, no problem, but not for a prolonged state.
Let's talk about the origins of SideLyer and this device and how it was created to address the needs of non-ambulatory clients.
So the SideLyer is a great story, and it was started in the late 2000s. No one knows the exact time, but 2008, 2009. And the director of nursing at Laurel Hill, which is one of our 3 long-term care facilities, she was struggling with a couple things. This population is not verbal, and they're not ambulatory, and they require 24-hour support. And they also require repositioning, because the part of their brain that helps them reposition helps all of us. So as we're sitting here, we're moving. It was, how do we do something to make sure they're safe, but include them more? Because previous to that point, most of the time these individuals would lay on mats on the floor, or they might be on platforms that were 2 to 3 feet off of the floor, but they were laying, and they'd be in a rotation for repositioning. And this was breaking our heart, because when you are laying, you are just laying, and you can't participate fully in what's going on.
Can you go back and tell me about the nurse or the caregiver provider who came up with the idea and why she came up with this idea?
There was a nurse that worked at Laurel Hill. Her husband built all the SideLyers for us. So originally, when I first started there many, many years ago, these SideLyers were stationary and they were on mat tables. So people were positioned either in left or right side lying, and it was stuck on what we call a mat table, which is an elevated padded table. And eventually, it kind of evolved into something with casters on it. And we had a night nurse that worked at Laurel Hill many years ago. Her husband was a carpenter, and when we explained that we needed these to be on frames with casters on it, he actually built these for us and made specific sized SideLyers, where people who were taller would have longer SideLyers, people who were shorter had smaller SideLyers, people who needed wider dimensions. We had our own custom SideLyers, and it actually turned into SideLyers that were decorated and color coordinated and had people's names on them and favorite colors and little stickers of things that they liked. And some of them had trays on them, some of them had additional storage depending on what their needs were and their communication devices, and there were even battery packs that were mounted on the bottom of it to provide power for either portable DVD players or like communication devices or switches so they can communicate their needs.
Before, what would have been the alternative? Just be in a wheelchair more and be away in your room?
So before, the alternative would have been they're either stuck in their wheelchair, and if they're having issues with skin integrity, they're kind of relegated to their bed and they don't have much option with involvement with their peers or activities, and they're missing out on a lot of stuff, and nobody wants to stay in bed all day and watch TV.
Now, when we talked, you talked about the importance of skin integrity, and repositioning clients, every 2 hours. So can you explain why this is so critical for the clients at Quest?
Yes. So the clients that we serve at Quest and many other clients that live in the community, whether it's at home or they're living in a hospital or a group home, they are unable to reposition themselves. A lot of them have what are called contractures, and their muscles are very tight and their arms and legs are in fixed positions. So once we position them in a certain way, they're stuck that way until we can move them. You and I can kind of, position ourselves and adjust our body weight, but these folks cannot do that. And so they consistently rely on us to move them every couple hours. And if you can imagine laying in bed or sitting in a chair and not being able to shift your weight around and move around as you talk, it would be very uncomfortable. And so we have to do this for those individuals, and this provides an alternate option for them to be positioned out of their chairs. If somebody is left in one position for too long, then they develop what is called a pressure injury. So the skin is reddened at first, and then eventually it'll break open and they can develop a pressure wound because they're stuck in a position for too long.
Can you share more about the story of the client with the severe tunneling wound and how the SideLyer or frequent repositioning could have helped prevent that?
A long time ago, we had a patient that was admitted to one of our facilities who had a tunneling pressure wound. And this was something that the family was told that would take months and months and months to heal because of how significant this injury was. And because of frequent repositioning, promoting good skin integrity, and just really having aggressive wound care, the wound was able to be healed in a matter of a few short months. Since this happened, the client was able to have great skin integrity from then on out. And because of the frequent repositioning that is within the facilities and the use of the SideLyer, we've been able to keep up with the good skin integrity of these individuals.
But what makes the modern SideLyer stand out compared to other positioning tools?
So the SideLyer is a mechanized repositioning device. It basically assists healthcare providers to safely and effectively reposition clients. Its primary purpose is to prevent pressure ulcers and pressure injuries, to improve client comfort, and hence overall client outcomes. It does ensure proper circulation and alignment for the clients. It helps to reposition the client at the push of a button. It's easy to manage skin integrity routines, and it helps with worker safety and workers' comfort as well.
So we're talking about benefits for both the clients and the staff.
Correct, that's right.
You know, what are the key features that SideLyer has developed to support providers especially and their users?
Absolutely, it's a great question. So one of the features is a motorized repositioning device at the push of a button. There is a control panel on the SideLyer that's right in front. There's also a remote control that can be moved at different locations. So that is one feature that's important. The second is a full range of motion, allowing for side-to-side rotation and also front-to-back rotation. It's lightweight and has a mobile design. It has wheels that can be moved around so that the client can have a social experience with their peers and with the providers. It also has little features like integrated rollout trays and attachable IV pole for added convenience as well.
So how effective was the, intervention in reducing PU prevalence?
Yeah, so recently there was an article published in the International Journal of Wound. And this article examined different techniques that could be potentially utilized to prevent or reduce pressure ulcers. And what they found was a dramatic reduction in pressure ulcer prevalence by 7.5%, which we expected from all the evidence that we've gained internally, but this sort of validated what we already knew, and we were excited to see that in an international journal. So very exciting information, and it really validated what we're doing with the SideLyer.
That translates to $16,000 in savings per patient. Facilities that use SideLyer aren't just improving care, they're reducing lawsuits, medical costs, and staffing injuries. The SideLyer has also had an impact on clients' families, who after so many years have seen firsthand how this device prevents pressure ulcers in clients. Tony Conrumney's daughter has been a Quest resident for over 20 years now. He's seen the impact the SideLyer has had on clients.
Well, Ronka got sick when she was like 2 weeks old, and it's been an uphill battle from there. When she got to be 13, me and my ex decided to move out to the clusters. So, and it's been a supportive, care from there. She likes it here. Ronka is very, very social. Very, very social. She loves to smile. She loves people, and everybody likes her.
And how has the SideLyer helped clients?
It takes a lot of pressure from the body part, the pressure area. So the SideLyer actually, is kind of good because most of her pressure is not where she can have a skin breakdown.
And what would it mean to see this in more facilities?
It will save money, and it will save a lot of money because pressure points, bed sores are really tough to heal. So definitely, money will be saved.
So can you walk me through the benefits and functionality of the SideLyer device, that Quest is bringing to market, and how do you see it improving the quality of life for your residents?
Well, one of the key things that it does is it allows someone to reposition with dignity and not just isolated in the bedroom like we mentioned. The SideLyer allows them to be at eye level with their peers and with others, so that they're a part of the group and can participate in activities or whatever's happening with the rest of the folks there.
From your perspective, how does the SideLyer device change the role or maybe the experience for your direct care staff in particular, in terms of, let's say, lifting and positioning and monitoring their residents?
Good question. So starting off with the repositioning aspect, what I love about the SideLyer is that it can start at a flat level, right? A lot of folks will have orders for a certain degree, a certain angle that they need to be repositioned at, right? Because of their needs. And the fact that a staff, if there's a bunch of different ways the staff can lift, but if they're doing a 2-person lift, for example, the person that has the upper body doesn't have to lift so high, right? Causing strains, causing pain to get them up into the inclined state. SideLyer is already at a flat state. You can just a 2-person lift over, or even if you're using a Hoyer lift, get them over, get them established, and then go with the incline.
Staff are given training on how to secure a client properly and adjust angles before use. It's practical, hands-on training and gets staff comfortable quickly using it.
I just see the benefit that has already provided to the individuals that we serve in real time. Again, it looks good, it's comfortable, it's durable. It's really gone a long way to improve the quality of life the individuals that we serve that need this device.
So with this active treatment, there's a lot of different goals that are run, and you can't always run goals from bed. You can't always run goals from wheelchair, sitting at a table. And the SideLyer allows them to have another position where they can have a table where they have a flat surface and they can either look at activity or utilize a piece of equipment and still be able to be positioned out of their wheelchair. So before, the alternative would have been they're either stuck in their wheelchair, and if they're having issues with skin integrity, they're kind of relegated to their bed and they don't have much option with involvement with their peers or activities, and they're missing out on a lot of stuff.
You're going from feet to faces and mobility. You get to participate in everything that goes on, and that's huge. When you are an able-bodied or typical person, you just take all that for granted. But when you see just the joy, you see the interaction, you see the responsiveness, it's like this is pretty powerful.
A simple piece of equipment can make a world of difference. For families, for caregivers, for clients. A simple idea, a powerful impact. This is SideLyer.
Hi, I am Dr. Macy Washington, PT. I have been a PT for 2 years, and me and my husband just moved here from New York in October. So I've been at Ann Stork Center for around 8 or 9 months now. Grew up in the South in Alabama, and then moved to New York in 2020, and then decided to move here with my family. So crazy story. When we first moved here, we had about a month between my husband getting a new job in August, and then they said, "Can you be here by October?" And we said, "Great." So I hurried and got all my licenses switched over, and then was applying to random jobs here in Florida. Had no idea what I was doing, and then came upon Ann Stork, and I applied on a website, and then Anita reached out, our boss, Anita McCrae, the director of therapy. She reached out and was like, "I would love for you to come in, see the place, do an interview." I was like, okay. The minute I stepped on this campus, I was just in awe of the facilities. I was in awe of the residents, the staff, the therapy team, the rehab team, just in awe of the work that they were doing. And I was like, I have to be a part of this. So our residents here are very sweet, very curious, and they are honestly one of a kind. So on my interview day, I was actually taken to one of the resident homes, and I'm kind of nervous. I'm with my, at that point, future boss, and I walk into this home, trying to be poised and collected, and then one of our very friendly residents gets up from his chair and just beelines for me. And I'm standing there with my boss like, oh goodness, what do I do? So I just put my hands up, and he grabs my hands and just puts his forehead to my forehead and just has the biggest smile. And that honestly probably sold it for me, because I was like, how can you not come work with residents like this, So our day-to-day looks different every day. But so we have at Ann Stork, we have a preschool, we have a private school, we have an outpatient center, and then we have our resident homes, which include the long-term care facilities, and then the adult day program. So a day in a life of a PT here is usually starting off with, going to the preschool, seeing some kiddos, and then we go into the resident homes, and that's where we do a lot of our heavy lifting, where we're putting them into positions. We're finding out things that they love to do functionally, like whether that's, hey, I want to learn how to brush my hair, then we're in there teaching them ways that they can brush their hair. It's going in there and seeing patients that may have some severe contractures or muscular deformities or skeletal deformities, and we're helping them get into these positions to make their life more comfortable and to make, whatever brings them joy, we want to make that adaptable and available for them. So whether that's they're learning how to walk to the bathroom, whether that's learning how to get up from a chair, whether that's providing them a more comfortable chair that they love. A lot of our residents like to play games. They like to just honestly interact with other adults. And so we're in there to do that with them, but also provide therapy for them while we do it. So we have a variety. We have the main ones are scoliosis. We have contractures, such shortening of muscle groups in different joints of the body that limits them in a lot of their functional abilities, whether that's reaching, walking, sitting on their own, propelling their wheelchair. So a lot of these things that we see, deformities in their body, can cause a decrease in their functional ability to do things that they want to do. Honestly, if you can't, think about it, if you have a contracture and your body is in a shortened position and you can't move around yourself, you might have an increased risk of skin breakdown, which is one of the most leading causes of sometimes even death in this population, because it can become really infected. And honestly, it's just a lower quality of life. Like, they have a wound that needs to heal and they can't move their body themselves to do it. So a lot of what we do is putting them in those positions to help those wounds heal and to prevent future wounds. So a lot of it is getting them into different positions, like I was saying earlier. So a typical session is, the first session is just getting to know them, what they want to do, the goals that they have for themselves, and then seeing their function at that point, and then how we can progress to the function that they want to be at. So whether that's they can't sit up on their own due to contractures or scoliosis or weakness or atrophy of their muscles, we are there to facilitate those muscle groups, give some stretches, manual therapy, STM, all the things, manual mobilizations to get them to the point they want to be, and that they're comfortable and safe and healthy. Soft tissue mobilization. So it's basically just a deep tissue massage. Oh, love it. So we have really enjoyed it. We have several residents that have been going on and off over the past couple of months that we've had it. And I don't know anyone that doesn't enjoy it. Any of our residents don't enjoy it. Obviously, they're a little hesitant of it at first. But honestly, it's been great. So we usually do all of our SideLying in bed or on different pieces of equipment, but this one is honestly an all-in-one. So it's easy to get them onto it. And even if we can't physically, for whatever reason, get the resident onto their side ourselves, the SideLyer is perfect, because even if we get them in semi-SideLying, like they're kind of on their back, kind of on their side, we can tilt the SideLyer enough to where gravity causes them to be on their side, and it's perfect. They're comfortable, they're safe. We're not breaking our backs to try to get them into a position, and it just makes, honestly, the whole experience more enjoyable for everyone. So we have a couple things. So we have tilt tables, which is, it doesn't go into SideLying, but we do standing and lying in different positions. Everyone has a tilt in space, not everyone, but majority of people have tilt in space wheelchairs. So we're distributing pressure in that way while they're sitting. And then obviously in bed or in like a softer chair, like a recliner is usually what we're using now. But you don't get as good of a stretch sometimes as you do with a SideLyer. So that's what's been really helpful, is that we're able to lengthen out areas of their body that need to be lengthened, like their spine or their extremities, especially lower extremities and their neck, and just getting them into the right positions, honestly, to help with their overall quality of life. Yeah, we faced a lot of challenges. Obviously, we got it done, and we have a great staff here that is really helpful. But it is a lot of hard work. And honestly, it can be hard on the residents' bodies as well, like always sliding them up and pulling them one way and rotating them the other way. Like, it can cause friction, it can cause an increased risk of skin breakdown, which is not great at all. So being able to have a piece of equipment that rotates them themselves is so much easier on our bodies and the residents' bodies as well. Like I said, most of the time our SideLying is done in bed, which is obviously in their room. And so it kind of, you know, for us it's a little disappointing, not that we can do anything about it because they're in their room, and we do what we can, like, you know, go in there every now and then and see them, turn music on, do things that they love, but it does isolate them. And it's disappointing for a lot of people because these residents love to interact with other people. Like, they want to talk to adults, they want to play games with each other, they want to watch TV together, they want to listen to music together. And the SideLyer provides the ability to have them in their SideLying position that's healthy for them, that helps them breathe better, stretches their body out, prevents contractures, but they're able to be in the environment with their peers and able to communicate with them and just be amongst them. I think what caught my eye first was honestly the functionality of it and the durability of it, because, you know, we go through a lot of equipment here, and when I first saw it, I was like, this one is going to save us so much time. It's going to be so much more convenient for us, so much more convenient for our residents. Our residents are not missing out on positions now because, you know, if we're going to choose between them being isolated in bed or interacting with their peers when they tell us, we're not going to isolate them in their room. We're going to have them be with their peers in their living room and in their home. And so this helps us do both at the same time. So that's what really caught my eye. Oh yeah, me and the other PT, Risa, we were involved completely. It was an every week thing. And I remember when you guys first came here, we were there watching you guys set it up and learning about all the controls and seeing how it would best benefit our residents. So mobility and angle control was my biggest thing, because I knew a lot of our residents couldn't initially get into SideLying all the way. And so the angle control is what I think is the most beneficial for a lot of our residents. I think because, you know, as what I've heard from past staff and staff that are still here that have been here for a long time, this is a normal thing for Anstork. Not the SideLyer, but equipment like this. So I knew that I was gonna, as a rehab department, we were gonna have people backing us on this, and I saw how confident and how much you guys were at Quest and at SideLyer, that you know that it works, and you guys were very adamant about that and very confident in us to also use it here. So we haven't made it to training all the staff yet. We have trained our rehab department, and we've showed a few of the house managers how to use it as well. But for DSPs, we have not started that initial training yet. But training rehab department has been pretty smooth. Yeah, everyone's been super excited every time we say we're going to use it. So I've honestly seen improvement in one of our residents' initial thoughts towards the SideLyer. I know that's a weird thing to say, but the first time we put him on it, he was a little hesitant, and we talked him through it and said, you know, what it was for, why we were doing this, why it was helpful for him. And now I think he looks forward to it, because I'll go in there and just mention, hey, we're gonna go over to Genesis and go on the SideLyer, and just his face lights up. He thinks it's like one of the best things ever. So I've seen improvement in quality of life in that way. And another one of our residents that we put on, her alertness has increased exponentially. So she usually is very lethargic, fatigued throughout the day, but when we put her on the SideLyer, her face also lights up and she's like, her body's alert, her muscles start contracting, you start to see her body relaxing to its full length. So that's where I've seen the most improvement. I think the social interest, it was unexpected because I wasn't sure how residents were going to respond. I knew that we knew it was a good thing, but I wasn't sure how they were going to take it, and to see how well they've adapted to it and how well that they have taken it on and accomplished so many things while being on the SideLyer is incredible. No, we haven't talked to guardians yet. I know the state guardian, I forgot her name. She has seen it before, and I've talked about in meetings before, and every guardian that has been in a meeting that the SideLyer has mentioned, there's a positive response to it. They're like, oh wow, we didn't know you guys were doing that. That's incredible. I would love to see it. So yeah, there's been a positive response. I would tell them to honestly consider this piece of equipment, because I think the benefits of it are varying, because it's not just this is good for the residents, this is good for the rehab department, this is good for the residents, this is good for the houses, because now they're not worried about, oh, who goes in what position. It's one piece of equipment that everyone knows how to use. So it's versatile, you know? Yeah, so I haven't been here long, but the stories that I've heard from staff who've been here for 20 plus years, they've always, every time I'm in the houses, they're talking about, oh, we used to do this, and we had this piece of equipment, and we had this person bringing in this. And so I see just the goal that Anstork has as a whole to provide innovative therapy, to provide new positions for residents, to just increase their functionality any way that we can and increase their quality of life. And honestly, Anstork does that. We find different people like you guys to come in and really work alongside us to make that goal happen.
Welcome, and thank you for your purchase of the SideLyer motorized medical repositioning device. In this video, we'll guide you through the setup, operation, and maintenance of your SideLyer. Whether you're a caregiver in a clinical setting or at home, this step-by-step guide will help you use the SideLyer safely and efficiently. Now, the SideLyer is designed to assist caregivers in repositioning individuals who are bed or wheelchair bound. It's suitable for use with adult and pediatric users that are within the weight capacity. SideLyer provides motorized adjustments to reduce caregiver strain while ensuring user comfort and safety. Before using the device, make sure to read the user manual thoroughly, watch this entire video, and follow all safety precautions. I want to first discuss some safety precautions with you before using the SideLyer. Ensure the device is placed on a flat, stable surface. Always secure the user with the safety harness. Do not exceed the 400-pound weight capacity. The device should only be operated by trained caregivers or medical personnel. Never leave a patient unattended while the device is in use, and do not use this device for purposes other than its intended use. Additional safety information can be found in the user guide, so be sure to have read and understand these important measures before using SideLyer. The SideLyer consists of three main components: base and backrest frames with cushions and footrest, cabinet and controls, and legs and wheel system. Each section is designed to enhance functionality and safety. Let's go over them in detail. Base and backrest frames with cushions. The backrest cushion and frame supports the user's back and allows for smooth adjustments during repositioning. The base cushion and frame serves as the main resting surface, designed for stability and comfort. The footrest is adjustable to support the user's feet with a weight limit of 40 pounds. It should not be used for standing or extra weight bearing. Next is the cabinet and controls. The cabinet housing contains the motor, battery compartment, and electronic control systems. The user control panel or full access controller is located on the cabinet, allowing caregivers to control all device movements. The remote control provides an intuitive interface for caregivers to operate the device with ease. It features identical control symbols as the main panel for consistency. The USB charging ports are located on the cabinet to charge mobile devices. Then there's the battery level indicator. The green light indicates the battery is above 30%, the red light indicates it's below 30% and requires recharging. If the battery reaches 0%, the tilt mechanism locks until it's recharged. On-off switch powers the device. Turn this on to check the charging status. Legs and wheel system. Each wheel rotates independently for smooth maneuvering. Locking casters ensure stability when the device is stationary. The extended legs prevent tipping and ensure weight distribution remains even. They must be used whenever the SideLyer is occupied. Additional components and accessories. There are some additional components and accessories to be aware of, including the IV pole. It's a detachable pole for securely hanging IV fluids or medications. The bedside tray. This provides a convenient surface for the user or caregiver. The power adapter and cradle is used for safe charging and storage of the device's power brick. And the harness, also known as the strap pad. This is essential to secure the user at all times. In this section, we will explore the additional features of the SideLyer that enhance user comfort, functionality, and ease of operation. These features ensure that the device is adaptable to various user needs. 1. Adjusting the footplate. The footplate can be lowered or raised depending on the user's height and comfort. To lower the footplate, press the hinge tabs inward and gently guide the plate downward. To raise the footplate, lift it back into position until it clicks into place. Ensure the footplate is securely positioned before use. 2. Adjusting the backrest angle. The backrest can be slightly reclined for additional comfort. To adjust, pull the tabs located on the adjustable hinges outward. Set the backrest at the desired angle and release the tabs to lock it in place. Confirm that the backrest is secure before positioning the user. 3. Using the IV pole. The SideLyer includes a detachable IV pole for medical needs. Insert the IV pole into one of the 2 designated slots at the head of the base frame. Ensure the pole is firmly in place before attaching IV equipment. Remove the IV pole when not in use for safety and storage. 4. Remote control storage. The remote control can be stored in the designated cradle when not in use. Attach the remote cradle to the front of the cabinet using screws. Keeping the remote stored properly prevents misplacement and damage. 5. Charging the SideLyer. Locate the charging port on the cabinet and connect the power adapter. Plug the adapter into a standard wall outlet. Avoid overcharging by disconnecting once the battery reaches 100%, and never operate the device while it is charging to prevent electrical hazards. 6. Engaging the leg stabilizers. The leg stabilizers enhance stability and should always be extended when the SideLyer is in use. To extend, loosen the side leg knob to engage the leg stabilizer. Remove the locking pin. Pull the leg outward and rotate into the downward position until it touches the floor. Tighten the side leg knob to secure it in place. Reinsert the locking pin for additional security. Retract the stabilizers and rotate into the upward position when moving or storing the device. Now let's explore how to operate the SideLyer. First, make sure the SideLyer is in a position where the power cord can be easily connected and disconnected. 1. Strapping the patient in. Position the user comfortably on the SideLyer. Place the padded strap across the torso and guide the straps through the space between the base and backrest frames. Wrap the straps around the backrest, secure the clasps, and tighten for a snug but comfortable fit. 2. Securing the patient. Ensure the user is centered on the base cushion. Adjust the backrest and footrest as needed for comfort. Then double-check that all straps are properly fastened before operation. 3. Moving the SideLyer. Unlock the wheel locks before attempting to move it. Always use the handlebars to push or pull. Be sure to move at a controlled pace and relock the wheels when stationary. Using the control panel and remote control. You can use the control panel or remote for easy positioning. Adjust the tilt, headrest, and base height as needed. Just press the reset button to return the device to a neutral position. Charging the SideLyer. To charge the unit, connect the power brick adapter to the charging port on the device. Connect the other end to a standard wall outlet. Do not use the device while charging and avoid overcharging. By following these steps, you can ensure safe and efficient use of the SideLyer. In the next section, we'll cover maintenance and troubleshooting. Routine maintenance keeps your SideLyer in top condition. Please follow these guidelines. Daily, inspect for visible damage and test the wheel system. Weekly, clean the device, especially patient contact areas with a disinfectant. Monthly, tighten screws, inspect battery life, and ensure all controls function properly. Cleaning, use a soft cloth with mild detergent. Remove cushions before cleaning. Avoid excess moisture near electrical components. If liquid is spilled on or around the product, disconnect the device from the power supply before cleaning. Dry all surfaces thoroughly before turning it back on and using it again. If you experience any issues, try these quick fixes. Device won't charge. If your device won't charge, ensure the power adapter is securely connected and check the outlet. Remote unresponsive? If the remote is unresponsive, replace the batteries or check for obstructions between the remote and receiver. Device difficult to move? If the device is difficult to move, check if the wheels are locked or if debris is blocking movement. SideLyer not tilting properly. If the SideLyer isn't tilting properly, ensure the battery is charged and that no objects are obstructing movement. Additional information about your SideLyer unit, such as technical specifications, repositioning controls, replacement, and warranty information, can all be found in the user guide. For further assistance, contact SideLyer Technical Support at 407-640-7722 or visit SideLyer.com. The SideLyer is a powerful tool that enhances user mobility and caregiver efficiency. By following these steps, you can ensure a smooth and safe experience. Thank you for watching, and be sure to consult your user manual for more details.
My name is Risa Rabald. I'm a physical therapist. I've been working over 20 years and been here a little over 5 years. And I really love it here, love Ann Stork. So I was working in the outpatient clinic at Memorial West, and I got a call from Anita, and she asked me if I would like to come to Ann Stork. And because I'd only been at Memorial for 3 months, I was like, no, I can't. I just started working here, and I got to learn more information. After about 6 months, I got another call from Anita, because we had somebody used to work here who knew me, and he kept telling Anita to try to get me to come over here. And I said, Anita, I'm not ready. And then I got a third call from Anita about after a year of working at Memorial, and I was coming home at like 11 o'clock at night, and I decided it was time, and it is one of the best decisions I've made, because I love coming to work every day. Anita McRae, she's director of rehab, basically takes care of our whole department. I was just thinking this morning, she is like the mother of all of us. Whenever there's a problem, it can even be outside work stuff. Doors always open. She is the best boss I've ever had. There are many stories. The ones that stick out is the time I brought my son here. He was here for a week, volunteer, and he hung out with me, and one of the residents came up to him and took his hands, and he just didn't know what to do. And I was like, it's good, it's good. And then he helped me with some residents in their room, and one of the residents, he's so funny, he said he's Popeye, and he told me I'm olive oil. And he kept saying, what did he say? Something about God. He would say, God bless, God is good. And he wanted us to say amen. So we said amen, and this is a year ago, and my son till this day talks about this resident, and he said he loves what we do here. So there is a preschool, and there is an ICF. So we go between both of the preschool and the ICF. We help the children walk, play in the playground, with all their activities of daily living, anything they need help with. And in the ICF, there are, the residents, they live here, and we help them with their movements as well. We help them if they have a contracture, if they have trouble moving, if they can't position themselves. We help reposition, we train staff, we talk to nurses. So we're very involved with the people here. Okay, an ICF is an intermediate care facility. In the intermediate care facility, they are residents who need like 24-hour nursing care. A lot of the residents have like a diagnosis of autism or cerebral palsy. We've had residents from age like 10 to elderly. So because they need the extra nursing care, this is the place for them. So in the adult population, there are many residents that have cerebral palsy. So they have, most of them have scoliosis. And because they cannot move, that's how they develop the scoliosis. We help them with their contractures. We help position them. We put them in SideLyer. We basically try to help them so they don't get skin breakdown. Okay, so if you can't move enough, you are at risk of muscle tightness. You may not be able to eat. You may be not able to sit up properly. You keep sliding over. We have a lot of residents that keep just sliding over in their chairs. They slide forward. They go to the side. They maybe look uncomfortable. So we come in there and try to position them. And we work hardest to position them in bed. We train staff. Okay, so first thing we do is we look at their alignment. We look at where their head is it to the side, what their shoulders look like, what their pelvis looks like, are they back in the chair properly? And then we work on positioning them. For the residents that can stand up, because we have a few that can stand up, we show staff how to help them move, how to help them stand up, how to help them walk, just to get them to their highest level of function. So I'm going to be quite honest, I was super skeptical. When I first found out about it, one of the therapists came here, we were really excited, and I was like, I don't know, I've seen SideLyers before here, and the residents didn't look that comfortable, it looked so rigid, and the surface was hard. I didn't think it was great, because they just were so flat. And we've had a tilt table. It works, so why do we need a SideLyer, right? Like, we position them in their bed in SideLyer. Why do they have to be on a SideLyer? So I was going through my pictures of all the people we positioned in recliners, positions in bed. There is no way to get them in proper alignment, and I'll tell you why. In the bed, every time somebody's in bed, especially with a breathing problem, we have to elevate the head of the bed. So, and not only that, the foot of the bed goes up too, because then they don't want the resident to slide down. So you're getting this person who should be like this, sort of crunched up like that, and they're like an accordion. So I'm thinking about everything that's going on inside, their lungs getting compressed, their intestines getting compressed, and these are people that need to breathe, and they have heart problems. So it always bothered me so much. I'm looking at the pictures, and I see, and I compared it to the picture on the SideLyer. This woman looked so good. So her body was straight, perfect alignment, and she was able to be tilted up without compressing her lungs. She looked amazing. Imagine somebody's in SideLyer, so they're already putting pressure on their lungs. And then, not only are they have to be in SideLyer because we have to turn them every 2 hours to prevent skin breakdown. But not only they're in SideLyer, and then the head of the bed goes up. So they're really getting compressed inside. So how are we helping them with their lungs if we're sort of making it harder for them to breathe in that position. But the SideLyer, it was great. It just looked like she was easy, had her eyes opened up. It just looked amazing. Okay, so we have to see them in their rooms if we're going to put them in an alternate position. And when they're in the rooms, we use wedges, we use pillows, and then the problem is that if a resident moves or if they get changed, they're never put right back in the same position they were. I mean, I've seen the trunk twisting one way, the legs twisting another way, and there's only so much you can do with enough pillows. They have body pillows, different pillows, but it never works properly enough. So initially I told you I was like, what? But very excited about it now. I can't wait to try more people on it. The people that we have on it so far are doing fantastic. We don't have to worry about wedge behind them, wedge in front of them. I had to put a pillow between somebody's legs, and that was about it. They can be tilted forward and back. We can distribute pressure on their backs. We can increase their lung perfusion. We can tilt the head up without their legs being bent up. So we increase blood flow. It's fantastic. Okay, so like I said before, we train staff. Now, once staff see how easy it is to use and that they don't have to keep lifting the person to position them, it is so much easier than lifting by being able to turn the SideLyer and tip it forward and back, that staff will see how beneficial it is for the resident and for them. So we're very excited to try it on more people. Okay, so that's 90% of our jobs is training. So far the whole rehab staff has been trained, and we know how to use it, how to position people on it. The next phase of our plan is to train the DSPs and have them do the actual work. They've seen us do it, so we're trying to do it at first as a rehab team project, and then let the DSPs get comfortable watching us do it, and now we're up to training. So this is the next phase. Yeah, the breathing, the circulation issues. I mean, watching people's head get elevated and then the foot of the bed come up and they look like their insides I'm picturing their insides getting compressed. At least I try to let the feet go down, but I've seen the head go up, the feet of the bed go up, and this is amazing. When I looked at the pictures, I reviewed all her pictures, and even in the recliner, as flat as I can get it, she still has to stay elevated because she's on a feeding and she has oxygen. So you look at her in the SideLyer, I've never seen her as aligned and as straight and as she is in that SideLyer. We usually we ask the DSPs to roll people from side to side every 2 hours. And in the SideLyer, because it has a tilt forward and tilt back, we have a much easier time, and all they have to do is press a button. So staff is gonna love this. Yeah, well, I can say for sure the residents love it. So the first time we put the resident in the SideLyer, I have a feeling it was because of the positioning. Her eyes lit up and she was smiling, and we don't usually see her smile that much. It may be a comfort thing, but her eyes lit up and she was smiling. I couldn't believe it. I think like at least 70%. I think it's going to be a big part of what we do. It's exciting to see residents very excited to go into it, and when staff see how happy the residents are, they will be more likely to use it. Comfort. So that's how I felt. And just think about someone's insides being compressed and not being able to breathe. And that'll make all the difference. Well, we like to try new things here, and our goal is to make people happy and to make them comfortable. So whatever we can provide for the residents, I know the managers here, everybody wants to see the residents happy and comfortable, so they will provide it.